So, how much research did you do at versus the practice?
Yeah, there's still a great deal of research between, I guess, the two programs and the two degrees. As a matter of fact, the whole purpose in creating the DNP was to bridge the gap. So they say there's as much as 10 to 15 years between research and actual practice. So when you walk into a provider or a clinician's office, what you're getting may not necessarily be the most up to date because we have such a gap. So DNPs, or doctors of nursing practice, were designed and created to help bridge that gap. Okay, so
when were they created?
I want to say sometime in the 90s, and please don't quote me on that. But yeah, that was the whole point, so we have our PhD colleagues, okay, but when do we, translate that to the bedside and in the community? And so that is why I chose the DNP route, the practice, the actual, hands-on and the translation of practice, of that research. So you bring up a great point with that.
Yeah, and again, that's why I have you on, because if I wrote an article about you, and hopefully at some point, I get to put you in Cleveland Magazine, or theland.org, or even Signal Cleveland here, all of the outlets that I write.
Name them all and put them on there.
Yeah, I'll try. That's definitely what it's about, right?
Speaking into existence.
Yeah. But that is so important. For one, general knowledge and information. We make a lot of assumptions. Again, that's why I have a show, because I want people like you. I don't want to be sitting here doing all this research and that's not my background, and then explaining what people like you have done and experienced and what your life is.
Yeah.
And then, as Black people, when we go to the doctor, do we go to the hospital? I should say,
right?
Because it's just like really what I said. Yeah. When we go to the doctor,
right?
We don't even really know who these people are, who is treating us,
Yeah.
what their level of education is, what we should expect from them.
Right.
And so again, that's when you said nurse practitioner. I said, when I saw that, because your background and experience, where I was introduced to you, is from the nonprofit organization you work for, and in scrubbing their website and speaking with the founder, Sherry White. I was like, wow, she has a nurse practitioner. Wow. I mean, she's just not doing this cancer work, just fly by night. She actually is doing the way, it's very good to see it being done, surrounding herself with the people who have the expertise.
Yeah.
And I was like, wow. Because how hard is it to get a nurse to come on the show?
Yeah. It matters, right? Just being out in the community and, sharing that knowledge and expertise. You asked me in the previous question, that I guess the differences in the years in terms of the education. So a registered nurse you can become a registered nurse in anywhere from 2 to 4 years. And then a nurse practitioner in about 5 to 6 years. And then the doctorate is another 2 years. Mm-hmm. So we're talking about, 8 years total, of education. So you're absolutely right. Just bringing that expertise, bringing that knowledge and those skills, it helps that it comes, like you said, directly from the person.
Yeah, mm-hmm. Yeah. So you can learn it, and so what or at least have an idea. Yeah. When you go someplace, you can ask and you can clarify and be like, okay, so this person is doing this, and so your expectation is in the right space.
Right.
Right. And so talk about, like, what's the experience actually doing the work on a day-to-day basis, because again, I'm sure this is something very informative. Mm-hmm. You learn a lot day-to-day, because one thing that I think I experience a lot when going to the doctors is when they try to generalize everything and make it based on what they read or researched versus who I am and what I'm telling you.
Exactly. So being a nurse practitioner, again, like I said, we function just like the physicians or the physician assistants, in the office. So when you walk in, we take your history, we perform physicals, come up with a plan with you, which may include some sort of, ordering some labs, some additional testing, sending over prescriptions, just like you would in any other setting. It could be, and nurse practitioners work in a variety of settings. So it could be an office, it could be a hospital, if you're ever hospitalized. Sometimes patients, we can see patients at the bedside. We work for insurance companies. We work in policy. We work in
that's big.
yeah, we work in nonprofits like I do with my Sister's Keeper. So we can work in a variety of settings, and it's nice because like I like to say, nursing and medicine meet. So the heart and function and the passion of a nurse meets with medicine. So where you really get to hopefully connect with the patient and helping them come up, with whatever treatment plan that's best for them. Um, so that's really what it looks like, not, and you may not even really notice a difference outside of that individual introducing themselves as a nurse practitioner. You may not even really know, but yeah, for the most part, we function all the same.
Okay. And so, when you say you're working under the doctors, do you have? So before you got your what is it called again? The DMP.
DMP. Yes.
So before you got the DMP, or with or without it, how does it work when you're with the supervisor, basically attending physician or something like that? What level of, should I say, for lack of a better word, authority do you have to instruct someone or guide someone or recommend something to a patient? That what do you need without the doctor's permission, and what can you do that the doctor has to approve?
Yeah, so and just so I'm clear, even with the doctorate degree, I still require physician collaboration. It doesn't, take that need away. This is an Ohio law. Okay, different laws have different.
Different states have different laws. It varies based on where you're at. Okay,
exactly. So there's actually quite a few states. I want to say upwards of 26 or so states where nurse practitioners don't require physician collaboration. But here in the state of Ohio, we still do. So what exactly does that all mean for nurse practitioners? Okay, it can be as involved or as hands-off, as the agreement is set. It could be simply a chart review.
So you have a written agreement with the hospital?
You got a written agreement with your physician, with your whatever group you're in, whatever hospital system you're working in terms of what it's going to look like. The minimum is that there is some sort of chart review done by the physician, at least once a month, so that they're aware of what their, nurse practitioner, is doing, how they're practicing. It can be as involved in, hey, I have a question about a patient, I would like your input on. So it could actually be collaborative, in a sense, as the name, suggests. And you can get advice, what would you do? How should I treat the patients? In the best sense, that's probably how it should be. Again, it's actually a written agreement between a nurse practitioner and a physician.